Hi there, Instagrammers. It's Dr. E here today, and we have a real special case. We have a young patient that we're going to be doing a breast augmentation on. What's so special about this case is that we're going to be using Allergan Soft Touch implants, which are the middle of the tier cohesiveness. So we're getting ready. We'll get you back there, and we'll take a look and see how everything goes. See you in a little bit. All right, so I hope you've enjoyed this part of our surgery. We're pretty much done right now. What we're gonna do is we're gonna close these incisions. I close them in multiple layers, get a real nice tight closure so that the scar heals very nicely. And this pretty much concludes it. We'll see you next time. All right, so we're pretty much done with our pocket dissection. And we've actually marked off before we started our surgery how medial we wanna do our dissection. You don't really want to start violating any further medial because then you start having problems in the future. So we got a very nice dissection complete. We're ready to put in the implants. We spent quite a bit of time preoperatively figuring out exactly what the patient wants and sizing so that when we're in the operating room, we can be very efficient and get this done very nicely and cleanly. So we're going to be using the Keller Funnel, and we're going to be using the 330cc SSM, which is the soft touch implant made by Allergan. I like to soak all my implants in triple antibiotic irrigation and betadine. I've changed my gloves. We've re-prepped everything. So these are clean gloves. And now we're going to just prepare the funnel with the same solution. And then the implant just simply goes into the funnel, taking care to know the orientation. And then what we're going to do here is we'll replace that retractor. And again, this is all behind the muscle. We're going to go ahead and irrigate the pocket with that same solution. We've already irrigated several times with just the antibiotic irrigation, but we'll do this one last time with the betadine and the antibiotic. And we're going to go ahead and insert that implant. It's as easy as that. Very simple. Good. And we're going to go ahead and complete the other side, and then we'll have you come back and we'll get some after photos as well. So we'll see you in a little bit. All right, guys, here we are, and we're going to get ready to start. We've already injected with the local, and we fashioned 4-centimeter incisions. That should be large enough to be able to get our silicone implants in. We're using the soft touch, which is a little bit more firm gel, so we would usually require a little bit larger incision, but with the use of the Keller funnel, we can still get away with making a 4-centimeter incision. So we're going to get started right away. So we put that incision just a millimeter or two above where the patient's breast tuck would be, so that once everything heals and the implants drop and settle, that incision is going to ride up just a slight bit underneath the breast, so it's virtually going to be invisible. You're not going to really see it. It's going to be very well hidden. So this incision is just underneath the breast tissue, and that's somewhat the advantage of going via this incision rather than going through the areola. When you go through the areola, you're going through quite a bit of breast tissue dissecting through. This is a little bit more of a direct approach, a little bit less likelihood of getting capsular contracture because you're not contaminating anything by going through the breast tissue and the breast tucks as you would through the areola. All right, so we're already at the muscle now. And this is the pectoralis muscle. So what we're doing right now is just releasing the pec muscle inferiorly so that we can get underneath the muscle and then do our pocket dissection for the implant. So we'll catch up again in a little bit.